and welcome back to Atlanta Living. I'm your host, Belinda Skelton. It is 8 minutes after 2 o'clock, and it looks like the rain has kind of stopped over Peachtree Street here at White Columns. A little more scattered on the map over there on the Storm Tracker HD on Channel 2. Well, we're going to switch gears here just a little bit. We were talking about wild turkey and then Rick's Rubs, and that was Rick's Rubs, RICK rub.com. There we go. And so try those out. But right now, Dr. Paul Cox, a friend of mine, through the show, I might add, that's how I met you, with myperfectage.com. Now, I brought you on the show because when I had you on the first time, I had so many people call in, and I heard so many people get help from you that I had to have you back. So thank you, Dr. Cox, for coming on again.
Thank you. It's my pleasure.
Now, we're going to be talking hormones.
Yes.
And we're not excluding men.
No, not at all.
Because men have hormones just as much as women do, and they're affected just as much as women are.
Yes.
And so first, let's start by saying that hormones control just about every part of the body.
They do. It's really interesting. You know, the thyroid controls your metabolism, and so that's extremely important. But, you know, people think of hormones as something that is commonly associated with the body. We think of hormone treatment as only affecting the body as far as, you know, we talk about testosterone. People think, well, it makes them leaner, it makes them more muscular. Estrogen, it makes your skin better. Progesterone makes your hair grow better. But what we really don't understand very well sometimes is that the hormones are vital for your brain health. If a woman doesn't have estrogen, progesterone, and testosterone, her brain is not as healthy as it could be. If a man doesn't have testosterone, he won't think as well. He may be depressed. He may not have any energy. He may be forgetful. He may not sleep. And the same thing for women. Even if they don't have hot flashes or night sweats after menopause, they can still have forgetfulness, irritability, sleeplessness, all these other kinds of things that people commonly attribute to just getting old, or, you know, we reach for an antidepressant to treat them, or tell them, oh, it's just that's just how things are.
Well, let's give people the phone number if they have questions for you. 404-872-0750. That's 404-872-0750. You said women can have problems with hormones that haven't reached menopause yet. What age do people, men and women, start seeing generally a problem with hormones kind of getting a little out of whack?
Well, you know, the interesting thing, thyroid disease is very common, and thyroid disease, it can happen as young as in your teens, and that can be for both men and women, although thyroid disease is much more common in women and tends to run in families. Okay. Now, the sex hormones, which we refer to like estrogen, progesterone, testosterone, those hormones in women can start having significant problems in the mid to late 30s. And that's when fertility tends to decline. That's also the time when women tend to have more problem with migraines, with problems like irritability, PMS, fibrocystic breast, and then also fibroids in the uterus. For men, testosterone declines at about 1 to 2% per year from the late 20s onward. And so we're seeing more and more men in their early 40s, and I think a lot of it's due to stress, that are already having significant issues with testosterone. But for most people, you could say from 35 on to 50 to 55, if you're going to have a hormonal issue, that's when it's going to occur.
And for myself, Dr. Cox, from the early age, I had every symptom of having a thyroid issue. Mm-hmm. I had dry hair, dry skin, problems sleeping, and I would go have my thyroid checked, and it would always come back normal. And this went on year after year after year. And my gynecologist would say, I know it's coming back normal, but I really think you have a thyroid issue.
Yes.
And then finally you said, what is normal for you may not be normal for someone else. This is just a guideline.
Right.
These numbers are just numbers.
Right. You have to look at the patient and you have to look at the numbers. And the thing to understand with labs, when a lab is done, it is basically a statistical analysis of the population on which the lab's being done. Well, if statistically 66% of America right now is overweight and sick, what's normal? It's overweight and sick. And so we have to look at not what's normal, but what's optimal. You know, the numbers don't tell the whole story. The patient tells the story, the numbers tell the story. You put the two things together and you decide how you're going to treat that individual.
Okay, but the problem is a lot of times the doctors don't get to spend enough time with the patient to figure all this out.
That's very true. The average doctor visit now lasts less than 15 minutes and they cover about 6 subjects. So there's not a lot of time for patient education. There's not a lot of time to listen, and then there's not a lot of time to synthesize all that together. And that's why in my practice, for example, my shortest appointment time is half an hour.
Right. And then we can get in a little later to concierge and VIP doctors.
Yes.
But, I had a lot of calls up there and they all went away.
Oops.
Well, I don't know what happened to that. Okay. Well, there are different hormones to look at. There are T3
Yes.
and T4.
Mm-hmm. Yes, with
What are the
thyroid.
differences?
Well, with thyroid, for example, you look at something called TSH, which is thyroid stimulating hormone. That comes from the brain. But then we look at the actual thyroid hormones, T4, which is produced by the thyroid, T3, which is converted from T4 in the body and has all the metabolic action of thyroid hormone. So all those have to be in balance and to really have a healthy thyroid. And if you don't check them all, then you don't know what's going on with those. And so it's really important to look at the entire system versus just looking at one piece of it in isolation.
So you need a very sensitive thyroid test.
Yes.
A hormone test to tell you what is going on.
You need to check all of the thyroid hormones, not just one. And a lot of times in medicine, what we do is either check a TSH or a free T4, and that's it. And so it's not telling you the whole story.
Okay. Folks, if you have questions for Dr. Paul Cox, give us a call, 404-872-0750. That's 404-872-0750. Are you having the classic signs of, are you tired? Do you have foggy brain? Do you have dry skin? Do you have trouble concentrating? All these are signs. Do you have muscle weakness? All these are signs. And there are so much misinformation out there that you could write a book just about the misinformation out there of just about women and the ways to treat hormone imbalances.
Yes, I think one of the biggest things out there that women keep hearing is that hormones are dangerous, that estrogen causes breast cancer, that you shouldn't take hormones. All that comes from one study that was done in 2002 that was done with a drug called Prempro. And that drug took...
is that still on the market?
It is. They took estrogens derived from horses, actually made from horse urine, and they took a compound that's like progesterone from a birth control pill. They put them together, and they did a study to see how women reacted to that. And they reacted very negatively. There was an increased risk of heart disease, increased risk of breast cancer, increased risk of stroke, and other things. So they took that study, they revealed the results, and we said, okay, hormone replacement's bad. Well, that type of hormone replacement is bad, but we have hormones that are called bioidentical, which simply means they're the exact same chemical structure as what our body would make. There have been many studies, most of them done in Europe, that were just as well designed as the study that was done here with the Prempro, that have shown conclusively that hormones do not cause breast cancer, and these hormones are actually good for you. They decrease your risk for osteoporosis. They may even decrease risk for heart disease in women. So there's a lot of good health benefits that have been proven, and there's good safety that's been proven as well. But you don't hear about that here in the U.S.
And also, you get to have those symptoms go away.
Yes.
Okay, we're going to take a break. We're going to get these calls screened. 404-872-0750. That's 404-872-0750. And then I'm going to get your opinion, Dr. Cox, on the over-the-counter medications for treating hormone replacements. All this and more on Atlanta Living on News 95.5 and AM 750 WSB.